Hello everyone, this is Dr. Gobind Rai Garg. First of all, a very happy Teachers Day to all of you. We are here to talk about FMG exam which was just held and how to prepare for the exam coming in December. The exam which was held just now, it was little atypical and will definitely say a little difficult too. So first of all, my request to all the parents, please stay by your word. Paper was little unexpected because the students are prepared in a different manner, but the paper was little different. So if the result is not positive, please stay by your son or daughter because they have worked very hard for this. So don't criticize them. Give them another chance. They can prepare well. Now, regarding the length of the paper, but to do ahead, the paper this time was quite lengthy. I will not say that much difficult, but because of the length of every question, it becomes little difficult to attempt in the stipulated time. So my advice is while preparing for the tests like grand test or championship test or any test you are giving, the important thing is you must see the time in which you are completing it. Earlier, if you were just completing the grand test, it was okay. But now plan to complete it 20 to 25 minutes before the stipulated time so that during the exam, even if the paper is little longer, you will not stuck up and you can easily read all the questions and attempt all the questions. Yeah? So be confident. You will definitely get through this time or not. If this time not, definitely next time. Yeah? So be positive. Everything will fall in place. Now I will pass on the baton to Dr. Sparsh Gupta.
Hi everybody. I hope you are sailing through this tough time. Now, you see, I understand and empathize with you on account of a relatively unexpected and a slightly tougher paper this time around. But I do have a couple of suggestions which might be useful to you in order to perform better, particularly for those of my friends who are not expecting a positive or a good result in the current exam. I'll just start by saying that let us analyze the paper logically when we say that it was a bit difficult this time around. You see why a lot of people found it difficult, and that too in the very first paper, was that instead of giving you the questions in a one-liner format, they actually presented to you the questions in a 3 to 4 line format. So the feedback that I received from a lot of you friends was that at the very outset of it, you thought that the paper was a bit tricky. But for those of you who had read those questions, you must have appreciated the fact that even though the length of the questions was a bit more, but the questions were actually given a clinical shade to them. Now, why do I say so is because I understand that some of us do give a preference to certain subjects over others. Let's say, for example, for my subject, a lot of you may have read my subject with a lot of enthusiasm, but sometimes because of paucity of time or because of non-preference, you do not give that much of a time to clinical subjects. Why do I say so is because you see pathology is going to be intimately related and interlinked with subjects like medicine, subjects like surgery, subjects like OBG. So even if somebody has studied pathology well, but he has not focused on the integration aspect of it, then the outcome is not going to be very much desirable. So my humble request to you is, especially for those of you who are going to be preparing for the exam for December 2020, whenever you are going through the subjects of pre and paraclinical, please make sure that you are also putting in effort in the clinical subjects. At least watch those videos so that you develop the interlinking and the correlation of the paraclinical and the clinical subjects in a better way. So that is what is going to be helpful in making that essential knowledge bridge that all of us educators are going to be emphasizing and re-emphasizing in our videos with you time and again. This simple advice is likely to make things relatively easier for you to comprehend in the exam and face the exam much more confidently. So that is my humble suggestion and advice to all of you. Now I would like to invite our public health expert, Dr. Vivek Jain, to talk about his views and suggestions on the paper.
Thank you, Sparsh sir. Hello friends, this is Dr. Vivek Jain, Faculty of Preventive and Social Medicine. Friends, based on my preliminary analysis of your August FMG exam, 2 important points I would like to drive home about. Number 1, questions were more or less same in most of the subjects, but definitely examiner tried to test your concepts by making it a more lengthy or a clinical scenario based question. Okay, let me take an example from my own subject PSM. There was one question on triage color coding he asked, which all of you know by heart, I'm sure. But how he gave the question to you in the FMG paper? In a train accident, 84 people died, 74 were severely injured, 32 were moderately injured, 24 were mild injured. Now arrange the color coding sequence. Color coding sequence is exactly same. Only thing is he has given you a lengthy scenario based questions. So friends, you need to focus more on the concepts, not only the question per se. Second important point I must drive home about, please, it's a humble request, watch your videos. Many students are relying only on notes. Only notes will not help. Please go through the videos. It will build up your concepts very, very strong. Now, friends, I would like to pass on the baton to Dr. Deepak Marwah, sir. To Dr. Deepak Marwah, sir.
Thank you so much, sir. Well, guys, I'll be short and precise. I have been teaching foreign medical graduates for 15 years plus, and my experience has been a roller coaster ride. I have seen questions which are very simple, sessions which are very easy to very difficult ones. But I personally feel that it is all about your attitude and your mental strength. My only message for you guys for December 2020 would be a all or a none law. You see, you have to give it your all, because the moment you compromise on certain subjects, then the performance will go down. Thank you so much, guys. And I request Dr. Apurv Mehra's views on this.
Thank you very much, sir. I will take it from the line all or none phenomena. So now everybody has to take care that they do all 19 subjects. Never ever ignore a subject. As said, questions will be lengthy because there will be integration. So each subject will be integrated with the other. You will have more clinical scenarios, but as told, the topics will stay the same. What adds on are the images, and there the role of snapshots will come. Have a look at important images, more so in the subjects which have more images, instruments and implants. So to summarize, we go through all this because we grow through all this. As a medical student, we should be ready to change and learn. As they say, change is the only constant. They will be lengthy, but answers are dependent on single line. Same topics which have been asked. They will integrate because clinical scenario doesn't come to a subject. It belongs to everybody. And they will show you most commonly asked things, most commonly seen things. If you remember this, I am sure you will clear any Indian exam, any international exam. This is my best wishes to all of you, the best wishes to all the great teachers with whom we have recorded this session and the entire team of PrepLadder. Thank you very much.
Videos in the detail how to prepare for different subjects. Thank you very much.
All the best, guys.